Good afternoon, ladies and gentlemen.
Good afternoon.
How you feeling?
Great.
Pretty good. All right. Who had lunch?
Yes.
Who's hungry? Oh, good, good. The food's working. Okay. How many of you, it's your first time that you're coming to one of my lectures? Really? You had to wait till everybody told you that 3 of them were good? Okay. So for those of you who are uninitiated, I guess I'll introduce myself. My name is Dr. Ed Sheldon. I'm from Los Angeles. I'm in practice as a psychotherapist for the last 20 years and hypnotherapist and holistic health person, founder and director of Integrative Health Services in Los Angeles, California, where we do succeed at helping people to get over stress and pain-related disorders with a minimal of invasive interventions and a minimal of medication, so that you're able to be as healthy as possible and as comfortable as possible without surgeries and all kinds of pain medication and stuff like that. Does that sound good?
Yes.
All right. Now, that I haven't told the other people because this is the first time I'm talking about this on the show. But what I want to tell the new people today is that I don't give canned talks, because when I was in college, I used to walk out and professors read to me. So rather than do that, it's true, you're laughing, but it's true. I am really here today, as I am on the ship in general, because many of you have been coming up to me during the cruise and asking me about personal things that I thought you would. In fact, yesterday there was a woman who came up to me on the deck who had a fear when she was taking pictures from heights that she would fall, and she felt very uncomfortable about it, and in about 5 minutes, we deconditioned that response and helped her to feel comfortable. Are you here today, that person? You are here. How are you today?
I'm fine.
You fine? Was it good?
Yes.
Yeah? Working?
Yes.
It works. Great. Is it how long have you had that difficulty?
Oh, I've not taken photos of heights very much of the time, but
For how many years have you had that problem?
as far back as I can remember.
How many years? Maybe you have a bad memory. I don't know. How many? She said as far back as she can remember. That could be yesterday. I don't know. 20, 30 years. What's your name? Betty has had this problem. How long did it take us to work on it?
Well, I thought you clarified it in maybe 5-10 minutes.
5 to 10 minutes. A problem that this very sweet woman had for 20 to 30 years. Where is it now? Overboard? It's overboard. It's gone. You like that? Okay. So, what I tell you also, those of you who are here new today, that you can sit there and say nothing, or you could ask your most deep questions, whatever you want, it's up to you. But I'm here in any way that I can to help you to be successful in whatever way that you want. Except I can't give you violin lessons, I don't know how to play. But when it has to do with something like this, if there's anything that I can do to help you, please feel free to ask. There are only good questions. There are no bad questions. Okay? And what I will do is I begin all of my talks by asking you to tell me why you came today and what it is that you would like to get from this experience. So just raise your hand, give me your name, I'll give it back to you, and a question or a goal, something you'd like. Who'd like to begin? Yes, your name?
My name is Ann,
Hi, Ann.
and some years ago I was in a lot of pain, and I had, in order to get out of it and move away from the drugs, I had to, find a way, which I used biofeedback at the time and coupled with some other things, but I just wanted to know if there's more insight along those lines. It was very effective.
What would you like?
Pardon?
What would you like today?
Today I would like to know, I would just like more insight, because I figure you never know when you need more insight, because you don't know what
Insight
you
into
get.
what?
into how to manage pain or stress.
Okay, good. Very good. Yes. Who's next? Yes, ma'am.
My name's Gloria.
Hi, Gloria.
And, the PAIN brought me in. I have arthritis and sometimes...
Such a dirty word, she'll only spell it. She said the PAIN brought me in. I'm sorry, what were you saying?
Oh, I have arthritis and occasional
Arthritis,
pain, and if there's a way to help with the pain, I'd like to know what it is.
Okay. Arthritis. Yes, next. Yes, ma'am. Your name?
Ellie?
Ellie. Hi.
Hi. I have constant pain, severe pain from fibromyalgia and from sciatica.
Okay, so we're talking about chronic severe pain. Thank you. Yes. Who else? Yes, sir.
My name is Jerry.
Hi, Jerry.
I'm here this afternoon in relationship to a stressful situation, and that my wife, unfortunately, is not well. She also suffers from arthritic pain and cardiopulmonary and asthma problems. And this has caused stress in all.
Did you say asthma?
Yes.
Thank you.
She's on a great deal of medication, and this has caused a stressful relationship both ways between us that I would like to seek some answers to.
Okay, I forgot, I'm sorry. Somebody came up to me at the end of my lecture a number of days ago and said to me, could you please repeat the question for those of you who can't hear? So I'm going to do this. We had one person who asked about arthritis pain, and somebody else asked about chronic severe pain. This gentleman said that there's an issue of stress in his family with his wife, who he loves dearly, because she is suffering from chronic pain, is on medication, suffering from asthma, and also
She has some
cardiopulmonary problems as well, and that the difficulty that presents is not only a medical one, but also it affects the relationship, and that's something which is very, very common. So thank you for sharing that, and I'll do my best to cover that. Thank you. Yes? And it doesn't have to be life-threatening, it could just be stress, because this is stress and pain reduction. Yes, sir? The name of this talk is Feeling Good, right? Feeling good, stress and pain. What does it say on the top of the sheet? Reduction, not management. Reduction. Yes. Management means you have it, you're stuck with it, and that's it. I want to help you reduce it. Yes, a gentleman in the back raised his hand.
My name is Joe.
I'm sorry?
My name is Joe.
Joe?
Yeah. I was wondering if you felt there's any relationship of foods to arthritic pain.
Okay, so we're going to talk about diet and arthritic pain. Okay, let me say something very important right now. I am not a medical doctor. I am a PhD in clinical psychology, a master's in clinical psychology, and a master's in child development, and a BA in education and psychology. I don't prescribe. I will advise. But I also want to tell you that any advice that I give you, everybody hear this, everybody pay total attention right now. Any advice that I give you, recheck it with your physician. I am not prescribing. I am not here as your physician. I'm here to give you information, to give you perhaps my perspective and views on things. It is true that I have had a lot of success with patients, or actually my patients have had a lot of success with all kinds of problems, and I'll share some of them with you. But please check with your primary and specialist physicians. If I suggest something, it might apply to a particular person in a particular situation and not to you. So please, please check it out. And while I'm saying that, let me say something else. I really recommend that people get second opinions, and sometimes fifth opinions, and take that seriously. I will tell you also, do not give away, since I see that all of the comments that were brought up were really about more serious issues. Very often, the questions and comments that I get are about how do I deal with the stress of a 2-hour commute on the freeway, which is a little bit of a different situation. And you're welcome to ask those kinds of questions too. But since we're talking about medical issues, and that's the questions that you've asked, and serious ones, let me give you another piece of advice, if I may. It's my own personal opinion. People tend, especially more from your generation than younger generations, for those of you who are a little older than I am, to deify doctors and to assume that whatever they say, it's right, they know what they're doing. A lot of people don't know what they're doing. A lot of people have practices now with the HMOs. They have 5 minutes to talk to you, and they didn't have the time to ask you an important question which would affect the answer they're going to give you as to what to do. Do not give away your power of reason and thinking to somebody else. Not to your husband, not to your wife, not to your doctor, unless you're mentally ill and you can't think for yourself. If you can think for yourself, then I recommend that you ask your physician, when you're dealing with a serious issue, to explain it to you so that you understand it. And so that this way you can be the ultimate decision maker about your life. This is very, very important. I'll give you just one quick example that came to me from about 18 years ago in my practice, maybe 17 years ago. A woman came to see me to get off of Valium. She was totally addicted. Her father was a doctor. Her mother used to take her father's prescription bag, and she was loaded on drugs all the time, but she would make her own prescriptions. And the daughter got addicted to all kinds of things. She was in her 30s, I believe, when she came to see me. And she says to me, Dr. Sheldon, and she came to see me because she was working on psychological issues. She was already off of Valium. She had some stomach upset. She went to her internist. You know what the internist said? Take some Valium. Okay, it's a true story. Okay. I had a patient in my practice years ago who both his surgeon and his chiropractor said he absolutely needed back surgery. There was no question about it. At that time, I had a health center, which was an interdisciplinary practice. We had a medical doctor, we had an acupuncturist who was actually a cardiologist who decided to go into acupuncture, nutrition, biofeedback, hypnosis, psychotherapy, body work, massage, a variety of people working together in the treatment of people. So what we did with this gentleman is we did some biofeedback, some hypnosis, and some psychological counseling. And I found out that, you know what was wrong with his back? He was carrying his father around on it all his adult life. He came from England, where basically men are taught not to be aware of their emotions too much. And he really had his father on his back. And he got his father off his back, and he actually moved to a more comfortable town, and his back problem went away. Okay. So it's very important. You know, I've talked in some of my other talks about secondary gain issues and motivations. Why is it that people get the illnesses that they have? I'll tell you, let me just put this down. It's very important, and again, let me tell you that when somebody uses the term psychosomatic, and they say it's all in your head, it doesn't mean that you don't have the physical pain. And it's not an insult. It's very important to understand that pain is a psychological experience. In general, it is. Some people have more tolerance and less tolerance to pain. Pain is a biochemical signal that God blesses us with so that we know that something's wrong and needs correction. Could you imagine if we did not have any pain, you wouldn't know to get your cavity filled, you'd end up with an abscess and maybe die from a tooth cavity. Or maybe you'd bleed to death because you wouldn't be aware that you were bleeding. So pain is a very important signal that the body gives the brain to let you know that there's something that needs to be done. So I'll give you an example. A woman came to me with a bad hip, and she was in a lot of pain. And as I mentioned before, I specialize in medical hypnosis. I prepared a woman for surgery on her jaw who was allergic to anesthesia, and they cut away her bone with no anesthesia. Okay, excuse me. So I said to this woman, I will be happy to help you not to feel the pain. But if you don't have some signal that you're overdoing it on your hip, you could wear your hip away, God forbid, and then you'll have a bigger problem. So I taught her hypnotically that her pinky would move like this, and that would be the pain signal instead of pain in her body. So you need some kind of signal to know that something's wrong, but it doesn't have to be the kind of pain that we experience. It's the same thing with emotional pain. If you take a Valium to feel more relaxed, and so physically you're drugged out, but you have something eating you up inside emotionally, it's important to be able to deal with the issues. On the other hand, there are anti-anxiety drugs that if you're so anxious you can't deal with your issues, that sometimes taking an anti-anxiety drug helps you to be calm enough to then deal with your issues, and then you don't need the anti-anxiety drug anymore because you dealt with your issue. So it's important how you utilize medication as an aid to help you to your ultimate goal, and not to use it in a way that is called iatrogenic. The word iatrogenic means when the treatment causes harm. It's the negative side effects. And you have to be careful that whatever treatments you choose, you know what the side effects are and how you're going to deal with them. Okay? So that was like my very serious part of the talk, but it's very, very serious. So let me go over it again. Don't give away your power to doctors to decide for you what you're going to do with your life. Let your doctor and your lawyer and your accountant and your nutritionist and everybody else be an advisor to you. And you make your decision what you're going to do. Try to understand what is the pain about. Now somebody mentioned asthma, and again, let me say something so that, God forbid, nobody's feelings get hurt. In my practice, I find that oftentimes there are psychological components to dis-ease. We call disease as dis-ease, okay, or illness. Now, it works in both directions. If you're totally stressed out, that can cause dis-ease. And if you have dis-ease, you can get stressed out, and then it can happen cyclically. Okay? Now, very often, people get medical problems because it's a metaphorical representation of what's going on psychologically or emotionally. And where the person gets the problem in their body is called the target organ, which is usually the weakest place for that particular person, and also depends on how they think. Because how you think affects your body. We all know that. You heard that fabulous juggling comic last night, wasn't he great? Well, when he said some words to you, you laughed. And if you were in pain at that moment, you started laughing, you no longer felt the pain in the same way, I guarantee you. It's true. Right? Who has a chronic pain problem here? Is it true that when you're laughing, okay. Now, laughing, by the way, is a wonderful thing because it also creates endorphin in the body, which is a natural pain reliever. You know what morphine is, right? Morphine is called morphine because it's related to endorphin. And the reason why the brain understands how to relate to that drug is because the brain synthesizes its own morphine called endorphin. Right? We synthesize our own painkillers inside of our bodies. Okay. So the way that we think affects sometimes what kind of problems we get. And we're going to talk, we're rolling a little bit here, we're going to talk about target organs. Now, a person who says, oh, my boss is a real pain in the neck, and says it over and over and over again, where do you think that person holds his or her stress?
Neck.
What kind of doctor does that person go to?
Neck doctor.
A neck doctor, a chiropractor, right? A person who says, I can't stomach my job, where do they get the problem? That's where they're holding the stress. What kind of doctor do they go to? The person who says, my spouse is a pain in the butt, what kind of doctor do they go to? Proctologist, that's right. Okay. Now, and it's true, because some people who are sort of what's called in Freudian terms, I'm not a Freudian, but what's called in Freudian terms anal retentive, people who hold in a lot, they're more likely to get spastic colon or colitis. Because they hold in and they hold in and they hold in until, and you know, if you just make a fist and you hold it long enough, that's what's going to happen to your muscle. You're going to be in pain and you won't be able to open your hand. Try it, and don't try it now, but it's something you can do at home. But it's true. If you hold your hand in a fist really tight and you try to open it, it will hurt. Okay? Headache pain is because you're holding stress in your head. Migraine headaches often happen when you've been stressed out for a long time and then you begin to relax and the blood starts flowing through, whereas tension headaches, it's the tightening up in the first place that creates that headache pain. Again, let me caution you. Anybody who has chronic headache pain, don't go to a hypnotist first, go to a neurologist and make sure that your head's okay. Because you wouldn't want to take pain medication and go to a hypnotist if, God forbid, you had a tumor. You go get checked out on the neurological level, and then you don't have to have the anxiety and stress of worrying, do you or don't you? If, God forbid, you do, then at least you can take the proper remedy to fix it. People oftentimes are afraid to get the truth from their doctors, but the truth is that when you get the truth, you're then in a position to do something to help you, to help yourself. If you don't know, then you have free-floating anxiety, you're concerned about what's going on, which tends to make things worse, and also you're putting off doing what you need to do. If you get a proper diagnosis, and say, wow, fabulous, I was really worried that this was happening, I had tingling in my feet, and I didn't know what was going on, I went to the doctor, okay, fine, I'm really fine, I just have to do such and such. Okay? So that's really important. Asthma is oftentimes an expression of emotional crying out that's being held in. It's that wheezing. When somebody wheezes, it sounds like crying. There are many kinds of disorders that have a psychological component to it. And if you take a look at what that is, then it can make it sometimes very easy to fix. And it's important not to make more out of something than it really is, because it's just nicer that way. Okay. Take a deep breath. Think about something that was really fun yesterday. Close your eyes. Take another deep breath. And think about the thing that you enjoy the most in the whole world, that you enjoy doing. See yourself, hear yourself, and feel yourself doing it. I see smiles on people's faces. So you know already that thoughts physically change your body. Your muscles have changed, whether it be smiles or your breathing or the part of your body you were using when you were enjoying that activity, maybe jogging around the track or whatever. That your thoughts physically change your body relatively quickly. And therefore, the thoughts that you have are very important for you to know what they are, consciously and unconsciously, and to be able to have mastery over your thinking process so you can have the kinds of thoughts that have an effect that is healing and healthy on your body. Okay, open your eyes, look at me. Hi, how are you? Do you feel better? Who said better? Right away the answer is better. Do you feel better now than you did 10 minutes ago? Yes. Now you know what happened? We were talking about all kinds of problems. And what happens when you do that? Your body responds to that. Now, if I, as a lecturer, for instance, would not have been aware that that was going on in you, and I just would have kept on right? Kept on with my whatever I was going to say, the lecture would go completely different than if I'm aware that the words that I said had an effect on you physiologically as well as emotionally and mentally. The effect was one of being a little bummed out maybe, or concerned or anxious. And when I notice that, because I have feedback from you, because even though you're not talking at the moment, but I'm watching your faces and I'm looking at your body language, I know something happened here in my audience. Or perhaps to my best friend or my wife or my daughter or son or friend or whatever. So if you're noticing what effect your words are having on people, you can then, number one, take responsibility for the effect that you have on people. You know, some people say, I have no idea. Every time I talk to this person, they just sort of want to walk away from me. Well, maybe it's because every time you're talking to them, you're fetching. That means talking about all kinds of problems. Being negative. Spewing out, unloading, as they say. Okay? So then you say, oh, you mean I have some part in this relationship? It's not just that they're walking away from me because they're antisocial, it's because I'm so negative. Right? So, okay, so that's an interesting thing I learned about myself. Now, what can I do to better my relationships? Oh, say something positive? Great, you know, have something, and then you can check it out, and you can see how people respond with you. But that's important to do with yourself. And more often, as we mentioned in the last lecture, a lot of us were taught that you have to be caregivers and take care of everybody else first, that we have forgotten to check in with ourselves. What thoughts inside our head that are unspoken verbally, but we're listening unconsciously, what are we saying to ourselves and how are we responding inside? People who are depressed tend to look in what direction? Down. In one of my former lectures, remember we had that woman come up here when we did the eye movement? Who was here for that lecture? Okay, so people who are depressed are looking down, and when you're in that kinesthetic auditory place, when you're in your head thinking about how you feel physically, your eyes are going down, and when you're talking to yourself, they're going down, okay, to the right or to the left. So the person's saying, they're looking down saying, I feel terrible. Yeah, I do. Back and forth, back and forth. And that's why if you want to get somebody to feel better, you just say things are looking up. You take a depressed person and actually have them force themselves to start looking up more, they'll actually change how they're feeling inside. Because those eye movements of looking down have become a conditioned response to being bummed out. Okay? So you have to really understand what is going on inside of you. It's fascinating because you become a detective. I want to really know, why am I being the way I'm being? And be careful. Don't be critical of yourselves and punish yourselves for not being as good as you'd like to be. You're not allowed to do that. Anybody who's read the Bible, it has even all kinds of punishments in it. Nowhere does it say anywhere, if you mess up, you punish yourself. It's not allowed. When you find that you've done something wrong, the answer isn't to punish yourself. If you haven't lived up to your expectation, the answer isn't to be bummed out on yourself and criticize yourself. You say, okay, I regret that that's what happened. What can I do now to become a better person? Because a person cannot do good spiritual development work or psychological development work or emotional or physical development work or sexual development work if they're in a state of depression. Depression is anti-health on all levels. Very, very important. And you have an obligation, as it says in the Bible, to take good care of your health. That's one of the commands in the Bible. You shall surely take good care of yourself. So if you don't have enough self-esteem to do it because you like yourself, if you believe in God, do it because God's telling you, then maybe you'll come to like yourself. And I'll tell you one thing about that, if I may. Can I say something quickly, maybe spiritual to you? Is that all right? What is really the essential self? Honesty. But, okay, what's another answer? What is like the essence of the self? Huh?
Knowing yourself.
Soul, okay? What's more the essence of yourself, your soul or your body? Really? Why do you think so? Huh. It's interesting. How many of you think that your soul is really more the real you than your body? Huh. The majority of you do. That's interesting. Okay. I'm not going to tell you what I think necessarily. I think in the long term that's true. If you believe that your soul is around before your body and after your body. Right? So your soul is eternal and your body is temporary. Is that right? So who agrees with that? The soul is eternal, comes before and after, and the body's temporary. Okay, how many of you think that when you're dead, that's it? Game's over. Okay, now, except for two people in the room, you all thought that the first option, that the soul goes beyond the body. Okay. And the other two will find out when they die that they were wrong. Okay, that's just joking. Just joking. Okay. All right. And it's good to just have fun with yourself, like I just did. It's okay to laugh at your own joke, you know, it's good. Okay, so if you identify with a part of you that's hurting, whether it be emotionally or physically or psychologically, and you identify with that as being your essential self, you're in trouble because it makes it more difficult to have mastery over fixing the problem and creating positive experience. If you see yourself, and the reason why is because from that perspective of yourself, you see yourself as damaged goods in a certain way. There's something wrong with me. And then if there's something wrong with me, then the corollary of that, what comes from that is, well, if there's something wrong with me, then I can't be that able to do positive things and fix it. Okay. Now, if you see yourself, your essential self, as being somewhat separate from the problem, then you can fix the problem. Okay. If the captain thinks that the captain is the ship and something goes wrong with the ship, then there's something went wrong with the captain. But if the captain sees the captain as the captain of the ship, and something goes wrong with the ship, then the captain is in a place to look at it from a more clear perspective and fix it. And we need to be the captains of our lives. Co-captains, I would say, from my perspective, because I believe in God. But we're co-creators, we're co-captains. Okay, we have to take responsibility. Awareness, relationship, responsibility, and motivation are the four cornerstones of most of my talks. You have to have awareness of what's going on inside. Awareness of how your thoughts and your emotions are affecting your body. Awareness of what's your relationship with your body. Some people relate with their bodies like their body's a machine, which isn't humanistic, loving, or kind, or respectful. Some people say, they don't say darn, they say the other word. My darn whatever is giving me pain today. Let's say arm, okay? My darn arm is giving me pain today. Well, so the arm says, if that's the way you're going to talk to me, I'll give you some more. And I'm very, very serious. I really, really mean it. So many of my patients in a deep level of hypnosis have said to me that part of their body is causing them pain in protest and in anger of how the person has been treating himself or herself. It's amazing. So it's important to have a loving relationship with your body. And that if some part of your body isn't functioning as well as you'd like it to have compassion and empathy and mercy and kindness and love and respect. I'm so sorry, Arm, that you're not feeling well today. What can I do for you? Not you, darn Arm. Look how you're screwing up my life. Because then you're putting yourself down, and you need to be able to have a working relationship with yourself. On the other hand, if God forbid somebody has some cancer cells, which, by the way, everybody does in the body when it's healthy kills them, cancer cells, you can say, okay, I'm not going to identify with them. This is something I really need to destroy and get rid of. But you can't do that with your arm if it's hurting you. Your arm, you say, what can I do for you that you'll feel better? And then we'll all feel better. So it's really, wow, partnership. Okay, obviously these talks are very deep issues. And you can't go to graduate school an hour and get your diploma. Okay, I hope I'm covering a lot of things for you though today, right?
Right.
Okay. It's important to ask yourselves what the metaphor is of your difficulty. And also what effect is it having on your life. And again, for those of you who haven't heard my other talks, secondary gain is the benefit you're getting from the symptom. I'll give you an example. Far out example. I'm sure that most of you have never suffered from this. But you know what herpes is? Yeah. Okay. A young man came to me with herpes. And I asked him in hypnosis, because I believe the kind of hypnosis that I do, and let me, for those of you who are new here also, do not pick a hypnotist out of the yellow pages. I don't care if he has a sign on his window that says he's a master hypnotherapist, because in most states, you can get a certificate from anybody telling you that you're the greatest one in the world because it's not licensed by the government anyway. Okay? Secondly, in most states, what the state requirement is to use hypnosis, if you're already a physician or a therapist, is minimal. In California, I believe it's still 40 hours. I'm certified by California to train doctors and therapists that do hypnosis. But what the state requires, bupkis, very little. Go to somebody who's really qualified. Make sure they're qualified. Don't just say, oh, I heard this great talk in hypnosis, I'm looking in the yellow pages. Don't do that. Okay. So this guy came to me with herpes, and in hypnosis, as I was saying, the kind of hypnosis that I do, based on the work of Milton Erickson and others like him, David Cheek, one of my mentors, is that your unconscious mind really knows a lot more than you do. So I asked him to ask his unconscious mind why he was having these outbreaks. And he said, because he didn't know how to say no to women when it came to sex. And, of course, if you have an outbreak, there's no question about it. You can't do it. So he said, well, we have to learn how to be assertive, don't we? We have to know how to be able to communicate with our mouths instead of with our diseases. And it cleared up, and he stopped having outbreaks. Okay? There are a lot of different kinds of illnesses like that, where a person will get a certain kind of illness to get sympathy from somebody, to distance. People who have issues, psychological issues of creative expression, might have throat problems, because that's the center for expression. So you have to understand what's going on. So if you're a singer, and you'd like to be a singer, and you're very critical of yourself, so if you give yourself a sore throat when you go on stage, then you can say, well, the reason why I didn't sing so well is because I had a sore throat, not because I'm not a good singer. That's an example of secondary gain. Okay? Now, the reason why I'm sighing is because I'm experiencing a little bit of stress right now, and it's good that I'm aware of it, because if I see the people who get the headaches at the end of the day are the people who have stress, but they're not aware of it, and then it builds up until they have a headache. My stress right now is what to cover in the next 12 minutes, because there's so many things that I'd like to share with you. Okay. Let me speak for a moment to this gentleman's question about stress in the family. Okay. It's very, very important to really communicate how you're feeling and thinking about your illness. I've had patients when their spouse was dying, they wouldn't talk about it. That happens often. Let's not talk about it. It used to be, the C word. Nobody would talk about it. You have to talk about it. You have to talk about the insecurities and the fears and the doubts and the anger and the disappointment and the frustration, and how it affects how you feel about God, and how it affects how you feel about life, and how it feels about limitations that you might have now, that you won't be able to do everything that you wanted to do. To be able to communicate about it with your family. It's very, very important. And it's very important for the person who is healthier to be able to encourage the person. Because the person who's sick doesn't want to put a burden on their spouse. But that's what love's about. Love isn't about not having to say you're sorry like it says in the movie. Love is about being able to say, I'm really sorry. I wish I could be more for you, and I feel bad that I can't do what I used to do. And then your spouse can say, well, I didn't marry you for that anyway. I married you because I love you. Disease and illness is one of the ways that life gives us to go to a deeper level inside of ourselves. One of my greatest loves, second to my family, is music. I'm a composer and singer. And in 1992, I had a hearing disorder. And I don't know if you can imagine, pick your favorite thing that you like to do that's your way of spiritual expression and creative expression, and you can't do it. And it gave me the opportunity to go to such a deep place and to pray so deeply and to see what can I do, how many doctors and acupuncturists, and what can I do to take care of myself. I have to change. I got hit by a truck in December. And I was going to the chiropractor, and leaving the chiropractor's office, I'm crossing the street, and a guy didn't see me crossing and almost ran me over. I really mean it, almost ran me over. And I looked at him and said, I just spontaneously said to him and says, you have to change your lifestyle, man. Because could you imagine being so unconscious you almost run somebody over? But sometimes we do that with ourselves. I used to work till 11, 12 o'clock at night with whatever it is. I don't do that anymore. I had to lower my stress level. 75% of why people go to doctors is stress related. You have to listen to your bodies and ask your bodies, what do you need? Am I really relating with you? How do you feel right now? What's going on inside? Okay? So it's very important to be able to talk with your wife and have her talk with you and to get to be even more in love and more loving and go to find a deeper place, find deeper strength, find deeper self-caring, find an opportunity not to be selfish about it. Okay? There are all kinds of things you can learn from it. And oftentimes, when you learn the lesson, your body gets better. Because just like pain is a signal, very often illness is a signal that you need to put your body in harmony. Now, Western medicine is more like taking your car into the repair shop. It's fixing symptoms. And Eastern medicine is more like how do you get your whole body to flow together, because that's how you're healthy. Not to fix this little piece, but what's happening in the whole picture. And I think my bias, obviously, is that you look at the whole picture. Somebody asked about diet. Now, I'm not a dietitian. There's a joke. What's the difference between a dietitian and a nutritionist? Dietitian tells you how many chocolate chip cookies you can eat, and a nutritionist tells you don't eat them. All right? So, of course, I had to lower my salt intake from my ear because salt retains water, and that affected the little hair cells in my ear. So yes, diet affects all kinds of things, but I can't consult to you more about that because I'm not a nutritionist. Okay, let's talk about feeling good. Let me just give you, as quickly as I can, some quick things that can be done for pain. Okay? I had a woman come to my office years ago with an implanted TENS unit in her lower back, I think it was, with a remote control like for a television and a cane. She walked out with the unit shut off without the cane. Okay? And I think that was the first session, 1 or 2 sessions. The brain, when you learn how to be able to access it on the unconscious level, because your brain is controlling right now your perspiration, your breathing, your heart rate, all kinds of stuff, the digestion of your lunch. Most of what's happening in your life right now is on automatic. Okay? When you learn how to access the part of your body that's automatic and go to the controls, just like taking off the cruise control of your car, now you're driving, okay? You can get your brain to just not feel the pain, oftentimes. How many of you have found a black and blue mark on your body somewhere you have no idea when you banged yourself? Okay. You were in a state of consciousness then when you were not aware of pain. You had hypnoanesthesia. And you just weren't aware of it. So the brain can do that for you. And there are a lot of methods and ways of doing that. You can do a whole workshop on just specific ways of doing it, but there are ways that your body can learn how to change. You can take, if it's a sharp pain, you could make it dull. I'll tell you just in 30 seconds, like the kinds of things I do using hypnosis. You can sort of, in hypnosis, create a control panel inside your head and have one for the volume and one for the treble and one for the bass and sort of change the way the experience is. Because again, pain is an electrochemical phenomenon that your brain gets the message and then psychologically interprets. So you can change how you're psychologically interpreting that biochemical signal coming to your brain. Okay, so there are a lot of different things you can do hypnotically with pain. Biofeedback is a very good way, if you have the right biofeedback therapist, because the big clinical study showed that what makes biofeedback effective is who's doing it, not the procedure. It's a way of helping you to gain the control over your body. You can raise and lower the temperature of your fingers, for instance. If you're hypertensive, high blood pressure, you could learn to warm up your hands and feet using a biofeedback instrument where your head controls the temperature of your body. What that's doing really is letting your muscles relax so much that the blood flow increases. And that's why relaxation and lack of stress is so important to health, because if you're stressed and you're tightening up inside, it restricts the flow of blood and energy to your body. When you restrict the natural flow of blood and healthy energy to your body, oxygen, nutrients, the chemicals of the body synthesizes that you need from your food, that's where the problem starts. Because you have a block. That's what acupuncture needles do. It gets the energy moving where it's blocked. Okay, so let's do a little meditation. Close your eyes, take a deep breath, get your bodies relaxed, put your feet flat on the floor. Deep breath, deep breath. Breathe in that life, breathe in that energy. And I want you to tell yourselves that you're now going to breathe in healing, light, healing energy in your breath. Okay, let's do that first. Just breathe. I want you to place yourself on a very, very comfortable bed or cushion or flotation mattress in your swimming pool or whatever. Put yourself, lay down in the most comfortable place you can imagine. The most comfortable experience you can imagine, you can experience, you can have, you can create, you can enjoy. Breathing on that very comfortable table, with the perfect temperature in the room and the perfect sounds that you like, music, birds, waterfall, anything that you like. And visualize basking your body in healing white light that is healing every cell, every organ, every blood vessel, every place in your body and mind and emotions. You can experience it, feel it, taste it, see it, hear it, enjoy it. Receive it. Feel worthy of receiving it. God wants you to be healthy. You know, the Talmud tells us that a doctor fulfills 2 commandments when he or she helps a sick person. One is the instructive to heal, and the other is to return a lost object. Because when somebody is ill, it is as if they had lost their health and they need it restored. Health is the natural state of being. Health is who you really are. So open your heart and open your mind and open every part of you to receive health, to receive comfort, to breathe a little easier, to make a commitment to be a partner with yourself and with your Creator for life and health, to have a peaceful body, to have harmony in your body, to have a loving and respectful relationship with every cell, to remember to check in with your body and say, "Hi, good morning, body. How are you feeling today? What can I do for you to make you feel better? Oh, you need to go to sleep instead of go to the late show? Okay, I won't push you tonight if you're tired. I'll give you what you need. Oh, you want a little less sugar? Okay, I'll get 1 scoop of ice cream. You need more sunlight? Okay, I'll go out on the deck. You need to be held? I'll find somebody who loves me to put their arms around me. And you know, until I find that person, I'm going to put my arms around myself. I'll give myself a foot massage. I'll take a bath and put on some nice music and light candles. You want things to be a little more calm in your home? I'll create a nicer place for you. You need to connect yourself with your Creator some more so you can receive all that blessing of health and light and healing. Okay, we'll talk some more. I need to be more accepting of my limitations. I have something that's not getting better yet. I'll accept it and do the best I can while I'm working on making it better. Oh, my body is slowing me down because I've been paying attention to the wrong things in life. I'll take time to think about what's really important. What's life really for? Am I spending enough time loving people and myself? Talking about things that are meaningful? Actualizing myself? Am I using my body for the right things? What was I created for? Where are my feet taking me to? What kind of experiences am I looking Am I listening to horror on the news hour after hour and wondering, why do I feel stressful? Maybe I need to shut off that television and put on some nice music. Or maybe I need to sing to myself. Or sit quietly. Tell yourself that you make a promise and a commitment today to be a partner in your health, in your happiness, in your relationships. And thank yourself for coming. See yourself this afternoon and tonight and tomorrow, and next week and next month and next year, and in 20 years, taking good care of yourself and feeling better than you do now. I thank you very much for coming. It's been a pleasure. Have a good cruise.